The talk from the next speaker is titled The Role and Importance of Biosafety Profession, and that is going to be delivered by Luis Alberto Carrera Ochoa. Mr. Ochoa currently serves as he's from the Michigan State University. So he currently serves as the High-Containment Laboratory or Pandemic Safety Manager for the Environmental Health and Safety Department at Michigan State University. From October 2019 to June 2021, he worked as the Director of the Epidemiological Surveillance and Research Laboratory Network of the Mexican Institute for Social Security from the Ministry of Health in Mexico. From March 2013 to October 2019, he served as the BSL-3 lab coordinator at the National Reference Laboratory in Mexico. But prior to that, prior to his current position, he served as a master's degree. He received a master's degree in public health management focused on biological risk management. He has been an ABSA member since 2014 and serves as the chair of the Publications Committee. And he is the member of the International Engagement Committee and the international editor for Applied Biosafety Journal. As one of the 18 founding members of the past president of the Amex Bio, he has strengthened the network between biosafety professionals in the region and helped to create strategic alliances with international and national institutions. Additionally, he has served as a mentor of the international twinning project from Sandia National Laboratories and the Next Generation Global Health Security Network as the Biosafety Biosecurity Working Group Coordinator. In addition, Mr. Ochoa serves as Senior Advisor for Pandemic Tech, a virtual incubator that enables innovative approaches to confronting infectious disease threat, and is a certified biosafety professional from IFBA for containment labs and biological risk management. Please join me to welcome Mr. Luis Alberto Ochoa Carrera from the Michigan State University to give us the next talk.
Hello, can you hear me?
Yes, we can hear you.
Perfect. And I believe that the staff is going to help me passing my slides.
Yes.
Perfect. Thank you so much. Ladies and gentlemen, good morning, good evening, or good afternoon, whatever you're listening to us. It's a privilege and a pleasure being here at this amazing event, and also I want to thank the organizers for inviting me to talk about this very important topic about the role and importance of the biosafety profession. So next slide, please. A very big mistake if you are a biosafety officer is try to think that you are only going to be responsible of the things that you mention to your trainees, not the ones that they understand. So I think, in my personal opinion, that the term of training, the term and the specific activities that we do to train people, it's has been very confusing, and this is something that we will need to clarify, because being a biosafety officer is more than being a teacher, is more than being just another scientific professional. So it is more about do things on the right way, on the right time, with right people. Next slide, please. So being a biosafety officer or develop such responsibilities is not and will never be an easy job. Depending on the region, the country, or institution, this profession can be named differently, such as biosafety professionals, biosafety responsibles, biorisk managers, and the real work of a biosafety officer is to take care of what's most important for an institution, which is the people. Being a good biosafety professional means that we need to know more about the people and not only regulations. Biosafety works requires critical thinking, being compassionate, resilient, curious, have humility, and always be a team player. We can acquire knowledge with the pass of the years. However, as technologies evolve into more complex pathways in life sciences, the biosafety professionals need to be updated. In example, with microbiological techniques, regulations, safety aspects, novel technologies, knowledge regarding different fields such as chemistry, physics, medicine, engineering, and become also behavioral specialists. Most of the times, biosafety officer works in silence, doing SOPs, trying to figure out how it works, and trying to have multiple answers, options for not stopping the work. But biosafety professionals exist because the simple reason that everything requires a balance. Next slide, please. Who has been empowered to make the safety decisions? The ministries of health, the laboratory directors, and who wants to make the decisions? That would be the scientists, the lab technicians, and also the biosafety professionals. The decision-making process is having a balance between the strategic pillars at our institutions. Therefore, they must go together to create conditions for this to be possible. Involvement means being passive, engagement means being active, and empowerment means ongoing effort. I know what you are thinking. I heard that at my institution. We all know that the typical phrases. Here's what I need from you. This is how you do it. This is what I want to look like. This is what you need to do next. Empowerment goes beyond that. Empowerment means, what do you need from me? This is where we are going. This is how your work will help our organization. Remember, this is a very dynamic process. Next slide, please. By participating in biosafety associations, the individual biosafety professionals are better able to collectively act on issues of concern, bring people together in small groups around issues they feel are important. Individuals can find a voice and can get a seat at the table to discuss several topics, can participate in a more formal way to achieve outcomes, and of course, start of a collective action, pursuit of shared vision and purpose through a team effort, synergistic interaction among individuals which emphasizes cooperation. Of course, synergy effect, the whole is greater than the sum of its parts. And also, how to start being a good biosafety officer means is to organize their members at one institution to mobilize these resources. If policymakers are listening to this presentation, I have an advice for you. So give them the opportunity to take care of what's most important to you, the human factor. Next slide, please. Where are we going? That is a very, very difficult but simple question. The biosafety profession is more than a network of connected people and a set of linked relationships. The biosafety profession is being a community of practice. Risk-based solutions require biosafety professionals to make sound judgments that best meets the local needs of an ever-changing workplace, focusing on applying knowledge in new situations. A great biosafety officer or a great biosafety professional requires critical thinking skills, mindset of inquiry, and effective problem solving. The risk-based solutions also require biosafety professionals to make sound judgments, and that means that a mode of thinking in which the individual analyzes, interprets, assesses, and reconstructs knowledge. Also requires intellect and humility. Recognize that no one is all-knowing and everyone can learn something. Curiosity, persistent, enthusiasm, fair-minded, and higher level learning, and not memorizing and recall of subject matter in the context of a problem or issue, and biosafety professionals have the option of offering a judgment of assessment and of possible solutions. Next slide, please. Planning the trainings. So if we are planning the trainings, how is this being done? The present training materials need to be used wisely, using adult learning theory and a variety of teaching methods, practical hands-on training, drills and exercises, and of course the individuals will retain more information by doing and applying critical thinking skills. So this is all about how, who, when, where, and why. Next slide, please. Getting everybody on board. Sometimes that could be, or we could think that this is impossible, but indeed, this will need to be possible, like others, and be liked by others. Effective communication is required. Fair but firm. Design practical solutions in consultation with the PIs, the other researchers, and please do not start penalizing unsafe actions. You are doing it wrong. That is not the best thing that we can tell to someone that made a mistake. So may suggest better practices to do this safety. It's okay. And that will create a positive behavior with the pass of the time. Next slide, please. Local and regional efforts. Talking about that, we have biosafety associations. Previously, no international program to measure competency of individuals carrying out biosecurity, biosafety, biorisk management activities. There have been several efforts in terms of the local efforts from different institutions, such as the ABSA, such as the IFBA, etc. So this is a very good opportunity for all to continue this preparation. So these are some of the negative attitudes that we can have or we can find in different places. Not only advance biosafety knowledge, certified biosafety professionals, advocate internationally, and connect our communities. Please remember the important skills for the 21st century. That will be the critical thinking, the collaboration, the communication, and the creativity. Promote processes that teach biosafety professionals how to think, evaluate, and apply critical thinking skills to facilitate risk-based solutions to biosafety issues. Next slide, please. The last slide that I have is just to show you a couple of information that has been published in the literature. And those are wonderful articles. If you want to download, they are free, so you can just put that in a browser and you will have access to these valuable papers. Next slide, please. And this final paper was published in the frame of COVID-19. So absolutely very good papers for a better understanding of the biosafety profession. Next slide, please. And with that, I would like to thank the organizers. And this was just like a brief overview of the importance of the biosafety profession. Being a biosafety professional is more than having a bunch of slides and a bunch of courses and a very big curriculum. This means to be more close to people. And being a biosafety officer means that you are going to take the right decisions because you are aware of the most important thing that one institution, organization, or country has, which is the human factor. So having said that, I would like to thank the organizers for having me here, and thank you so much. If you have any questions, I will be more than glad to answer them.